What's up, nursing students, future nurses? Today, let's review 20 high yield NCLEX questions that you really need to know. This is a mixture of Med-Surg, OB, maternal nursing, of course, pediatric nursing, mental health. Okay, so let's start with question number one. Are you guys ready? Okay, so question number one is a patient with COPD has an oxygen saturation of 88% at room air. Which action supports adequate oxygenation? So I'm going to give you guys 10 seconds to answer this question, and then I'll reveal the correct answer with the rational, okay? Okay, so for this question number one, the correct answer is letter C. Encourage controlled pursed lip breathing. So always remember this. Pursed lip breathing slows exhalation and improves oxygenation and ventilation. This helps with the patient blowing off the trapped CO2. Okay, let's go to question number two. A patient with DKA has Kussmaul's respirations. What does this pattern indicate? So the correct answer is letter B. Remember, Kussmaul's respirations help remove acid, which is the ketones. Remember, ketones are acid, by blowing off CO2. The body uses this to compensate for severe metabolic acidosis in DKA. So let's go to question number three. Let me just position my microphone here. Question number three. A patient develops sudden unilateral leg swelling after surgery. Which finding supports DVT? So deep vein thrombosis. Okay, y'all, the correct answer is letter C. The cough, tenderness with swelling supports impaired venous flow, which is consistent with DVT formation. Let's go to question number four. A patient with SIADH is being monitored. Which assessment needs attention? Okay, the correct answer for question number four is letter A. Sodium of 122 indicates delusional hyponatremia from excess water retention. This can cause seizures and requires prompt action. Let's go to question number five. A patient receiving furosemide shows ECG U waves. Which lab value explains this finding? Okay, so letter A is the correct answer. Low potassium causes U waves on ECG. Diuretics such as furosemide increase potassium loss, which leads to this change. So before we go to question number six, let me know where everybody's watching this video, okay? In the comment section of this video. So let's go to question number six. We're gonna go to question number six. Make sure of that. So question number six. A patient is receiving enteral feedings through an NG tube. Which action supports correct placement before starting the feeding? Fundamentals of nursing. Correct answer for question number 6 is letter A. Gastric pH verifies the tube is in the stomach. It is the safest bedside method that we could use. Question number 7. Go to maternal newborn. A laboring patient reports sudden intense abdominal pain followed by loss of fetal station. Which finding supports uterine rupture? Correct answer is 7. Okay, so fetal bradycardia occurs when uterine rupture interrupts oxygen flow to the fetus. Question number 8. Med-Surg. Patient with pneumonia has increasing shortness of breath. Which assessment supports worsening gas exchange? Correct answer is letter A. Low oxygen saturation indicates impaired diffusion and inadequate oxygen therapy. Question number 9, pediatric. A 2-year-old with dehydration is receiving IV fluids. Which finding supports improvement? If you selected letter A, you are correct. So normal capillary refill shows restored perfusion and circulating volume. Let's go to question number 10. And we're going to mental health. Okay. A patient with major depressive disorder states, I feel like everyone would be better off without me. Which response supports safety assessment? Correct answer is letter C. Determining if the patient has a plan helps assess immediate suicide risk. So question number 10 is done. So far, how many correct answers did you get? Take note of that. This is a new channel in YouTube. So if you're able to subscribe so that you get daily questions and answers, that would help. Okay, so let's go to question number 11. So question number 11 is medical surgical nursing. A patient with newly diagnosed hypertension reports a persistent dry cough after starting a medication. Which finding supports an adverse effect? The best answer to this question is letter A. ACE inhibitors can trigger a dry, persistent cough due to the bradykinin buildup. So remember that it's bradykinin that's causing the patient to cough. Question number 12. Pediatrics. A school-aged child with asthma develops increasing wheezing despite using a rescue inhaler. Which assessment supports worsening airway obstruction? 10 seconds. Correct answer is letter A. Peak flow less than 50%, so that's always the case, signals severe obstruction and poor airflow. So let's go to question number 13, fundamentals of nursing. A patient requires a sterile dressing change. Which action supports sterile technique? correct answer is letter A. Hands must stay above the waist to maintain sterility. Remember that, and avoid contamination. Let's go to question number 14. Maternal and newborn content. A postpartum patient reports severe perineal pain and cannot sit comfortably. Which finding supports a hematoma? Okay, letter C is the correct answer. Did you get that? A firm, swollen, painful perineal mass indicates blood collection in the tissue. Let's go to question number 15, which is mental health again. A patient with bipolar disorder is in a major manic episode. Which finding supports impaired judgment? 15 seconds for you. Sorry, 10 seconds. Sorry. Okay, so letter A is the correct answer. Risky, unrestrained behaviors like excessive spending show impaired judgment. Okay, so that's 15 questions. How many did we get right? Hope everybody's okay. Thank you for watching, okay? So like I said, this is a new YouTube channel account. So we have 48 subscribers. Let's reach more so that we can reach a lot of nursing students out there. Okay, question number 16. An infant with bronchiolitis, shows increased work of breathing. Which finding supports worsening airway obstruction? Okay, question number 16. The answer is letter A. Nasal flaring signals increased effort to maintain airflow in infants. Let's go to question number 17. Fundamentals of nursing. A patient is at risk for falls. Which action supports safety? 10 seconds. The correct answer for question 17 is letter A. Placing essential items within reach lowers the chance of unsteady movement. Let's go to question number 18. Maternal newborn. A patient in labor has variable deceleration on fetal monitoring. Which finding supports cord compression? Correct answer, question number 18 is letter A, variable deceleration. That's what we call variable deceleration, y'all. Uh, Shows sudden drops in fetal heart rate caused by cord compression. Let's go to question number 19. Let me see if I can get that on the screen. There you go. Mental health. A patient with schizophrenia reports hearing voices that comment on their behavior. Which finding supports hallucination? Okay, the correct answer is letter A. Actively responding to stimuli that are not present indicates auditory hallucination. Question number 20, our last question for this video. Med-Surg, a patient with heart failure has worsening shortness of breath and crackles. Which finding supports fluid retention? Okay, correct answer is letter A. Rapid weight gain reflects acute fluid accumulation, a key sign of worsening heart condition. That's our last question, y'all. Thank you for watching, and let me know in the comment section what topic you want me to cover next time. You guys have a good day. Thank you.